All right, so I'm recording this on my phone because my laptop is not working properly. It's stressing me out. But anyway, today's date was July 27th, 2021, and my unit was 882. And my assessment today was on a 51-year-old female who came in with having chest pain, night sweats, and diarrhea, which was suddenly about only the night before she was admitted. So she was reporting the chest pain as a crushing chest pain, and was said that she was feeling fine up until the night before admission or night of admission. Her past medical history: she was diagnosed with type 2 diabetes, hypertension, alcoholism, and morbid obesity. So her current medical diagnosis was septic shock and acute pancreatitis induced by alcohol. So alcohol-induced acute pancreatitis. And so let's see. Her vitals were normal within normal limits. Besides her blood pressure was really high. It ranged from 163/91 in the morning to 169/78, which was taken around 1300 today. And let's see, she was given some multiple medications. She was given albuterol puffs for wheezing. She was having really hard time, trouble breathing, and she was reporting having panic attacks in the hospital, especially today, which she said that she normally never has. But she had explained that she thought it was because of her procedure that she was having today, which was around 10:30. She had a left heart catheterization to look for stress because she also had high troponin levels. So they were looking for any multiple vessel blockage. However, she didn't. And so right after her results came back and she came back, her anxiety was pretty much gone. She was way happier. And her pain levels for her chest pain were really low. She originally ranked it about an 8 out of 10 in the morning, and then after her procedure she was reporting about a 3 out of 10. However, this was also after her pain medication as well. Let's see. And then other medications, she was given Pepcid for indigestion associated with her diabetes, folic acid because she was deficient. She was given blood pressure medication, some potassium bicarb citric acid because her potassium was low, it was below 3.5. So my diagnosis was acute pain, which is the state in which an individual experiences and communicates presence of severe discomfort or uncomfortable feeling for less than 6 months. And this was related to her hypertension and her diabetes, as evidenced by shortness of breath and her chest pain. Let's see. So for short-term planning, I wrote pain control. So the patient will experience a decrease in pain severity from 7 out of 10 to 4 out of 10 within 1 hour of receiving pain medication. And then so for the interventions, we monitored her blood pressure and her heart rate quite a bit. I probably took vital signs on her maybe 4 or 5 times throughout the day. My nurse also had to monitor her blood pressure and her heart rate to administer some medication that was prescribed earlier this morning to help with the procedure. And then the other intervention was administering her meds per MAR. So for evaluation, she did experience a decrease in pain within an hour of administering meds. She ranked it about a 3 out of 10. And then for long-term planning or discharge planning, I wrote diabetes education. She also actually had a staff member today visit her to talk about further planning on helping her diabetes, and giving her the resources to change her diet and her eating ways. So that's what I wrote for specific information on her diabetes education. So I said looking out for what foods will increase her blood sugar and cutting those out of her diet. And she also had agreed to taking a cooking class that TGH provides to patients with diabetes, which is really cool, where they teach them how to cook healthier meals that's easier for them and more accessible to them as well. And that's it.